Assalamualaikum and good morning. I would like to thank each and every one of you for being here with us at the live session from Masa University Saujana Putra Campus. I'm Umi Sarah Zulkifli. I'm from Faculty of Health Science, Masa University. Will be moderating today's session. Today's webinar title is Contrast Enhancement Computed Tomography, or we call it CECT, and is proudly organized by the Faculty of Health Science, Masa University. Dear viewer, before we proceed, I would like to give you a brief program provided by Faculty of Health Science, Masa University. Faculty of Health Science have three departments: School of Physiotherapy, Department of Environmental Health, Department of Medical Imaging. This is all the programs that we'll offer in all the three departments. From School of Physiotherapy, we have a Diploma in Physiotherapy, Bachelor of Physiotherapy Honors, Bachelor of Physiotherapy ODL, and Master of Physiotherapy. For Department of Environmental Health, Diploma in Environmental Health, Bachelor of Environmental Health and Safety, Honors, Bachelor of Environmental Health and Safety, ODL, and Diploma in Occupational Safe and Health. For Department of Medical Imaging, Diploma in Medical Imaging, Radiography, Bachelor of Medical Imaging, Honors, Bachelor of Medical Imaging, ODL. Why you should join the health science? First, high job demands, essential service, no boring work routine, lucrative remuneration, low risk of job redundancy, opportunity to work in variety of settings, a career you can feel good about. This is the information program for Faculty of Health Science. Master of Physiotherapy is 1 year program full-time and 2 year program for part-time student. And this is the entry requirement for Master of Physiotherapy. Okay, and this is the program for bachelor degree in Faculty of Health Science. We have Bachelor of Therapy, Bachelor of Physiotherapy Open and Distance Learning, Bachelor of Environmental Health and Safety, and Bachelor of Environmental Health and Safety Open and Distance Learning, Bachelor of Medical Imaging, and Bachelor of Medical Imaging Open and Distance Learning. This is the entry requirement for bachelor program at the Faculty of Health Science. For diploma program, we have Diploma in Physiotherapy, Diploma in Environmental Health, and Diploma in Medical Imaging. And this is the entry requirement for diploma program. Diploma in Occupational Safe and Health, 3 years program. And this is the entry requirement for the diploma entry. If you want to know more about this program, you can visit at www.masa.edu.my. Why choose Faculty of Health Science Masa University? First, we have interactive teaching and emphasis on hands-on clinical skill, face-to-face and online platform. And also we have a wide list of hospitals, institutions, or clinical and industrial placement. And our program is accredited by MQA and JPA with international recognition. And we have a dual award with ARU program. And we have a cross-teaching by the expert. Masa has the most number of health discipline in single institution among IPTS. We have the various study mode. We have conventional, we have open and distance learning. And we have also experienced and dedicated international pool of academic staff. Masa also have a Masa scholarship. We have a Haji Abdullah Academic Excellence Scholarship, Foundation Scholarship, Blue Ribbon Scholarship, School Teacher Scholarship, Family Scholarship, the Single Parent Scholarship, and you can find out information through the website. And Masa also have a lot of collaboration and affiliation with association and society. And we also have a student mobility program, interchange student with the overseas university. This is the pictures of the student mobility program. Okay. And we welcome you to join us. So if you have anything, please contact us through a Masa website. Um, or our Facebook about leave a comment and we'll get back to you. Your question concerning this webinar session can be listed in the chat box. Okay, before we start, let me give a brief information on the webinar topic today. This topic is related to contrast enhancement, which is very important for successful diagnostic CT scan. This purpose of contrast enhanced CT or CECT is to find pathology by enhancing the contrast between a lesion and the normal surrounding tissues. Sometimes a lesion will be hypovascular compared to the normal tissue. In some cases, a lesion will be hypervascular to the surrounding tissue in certain phase of enhancement. Okay, let me introduce the speaker for today's session, Ms. Ainul Fadlin Othman.
Waalaikumsalam. Hai, Panumi.
Okay, before we start, let me give an introduction to our speaker today. Ms. Ainul Fadlin is a medical imaging department lecturer at Masa University. She possesses a Bachelor of Diagnostic Imaging and Therapy and also Master of Radiation and Nuclear Safety at the University Kebangsaan Malaysia. She has previously served as a radiographer in a few private hospitals and have more than 5 years of academic experience in medical imaging. Ms. Ainul, do you ready? The screen is yours.
Okay. Thank you very much, Puan Umi, for a very nice. All right, so here my sharing. Hopefully, all of you can see my Fadlin bin Othman. I'm the lecturer at Masa University. Okay, so my entitled Trust Enhanced Computed Tomography, also known as CECT. Okay, so let me start with this presentation. All right. So I will start with a brief introduction about computed tomography. Okay, firstly, all right, the general introduction of computed tomography examination in the medical imaging field, especially. Okay, and then we will go to the focus of our today's sharing session, which is the contrast enhanced computed tomography. The purpose of this kind of examination, okay, the contrast enhanced computed tomography purpose, the variety of route of contrast media administration that are available in order to fulfill the purpose of CECT. All right, then we will move into the image appearances. Okay, the comparison between the unenhanced computed tomography also explain and how when we can play in high contrast. All right, and our sharing session, I will also touch a little bit also when we miss the to our this is the in in medical imaging field. Okay, computed tomography known as a medical imaging technique that will produce images, or rather the set of images in cross section, okay, for the entire body. If let's say we want to image our brain, our head area, for example, right? So we can see, we can get the image of the brain tissue, of the bone structure, all right, at the area of the brain, of the head, with the cross sectional. Okay, whether in the axial transverse section, okay, coronal section, okay, and also in sagittal section. Okay, this is because the exosomography can be rotated around the patient's body, like what we have in this figure number 1. Okay, it will rotate around across the patient's body. The patient, our GAN 3 here, all right. So when we on our machine, okay, we start to rotate the tube, okay, so we'll move continuously, all right. So this is where we can get the image in cross-sectional, right? So let's have some history behind this facility or this computed tomography. It was firstly invented by Sir Godfrey Hounsfield back in 1970, year back then. Okay, where this Mr. Sir Hounsfield talked about projection of X-ray beam when we have the X-ray beam to move an object, which particular box comes in. All right. Then throughout the process, Mr. Hounsfield also will continue to improve the CT scanner, first generation, newly generation, we call it as helical scanning. The CT scanning protocol, and including the usage
Okay, sorry for the interruption. It appears that some technical difficulties. My sincere apology. While waiting for the issue to be resolved, we will try to reconnect it back to the speaker.
Okay, sorry. So sorry. Okay, let's see if I can reshare my screen. Okay. All right, let's continue, okay? All right, so as the scanner also evolved throughout the time, okay, same goes to the advancement in the CT scanning protocol. We established a better protocol in order to give service towards our patient and also the public, okay. Same goes to the usage of contrast agent in order to increase the visualization of the computer tomography system. All right. So tomography cases in this data. All right. In Malaysia, the total number of CT cases can be concluded in this table. Okay, this is from Ministry of Health back data. Okay, back in 2010. Okay, almost 500,000 cases. Okay, of computer tomography cases has been done. Okay, so this is contribute towards a high number in CT scanning. So here is where we as a healthcare provider, for example, we need to establish a very optimum kind of CT scanning protocol in order to serve better towards our population, towards our patient, right? So as the case of computer tomography is very big in number, and surely it will increase throughout the year as well. Okay. Okay, so let's now focus on contrast enhanced computed tomography, our main topic for today. All right, so contrast enhanced computed tomography is actually a procedure by introduce material or contrast agent into while we perform CT scanning process. That's now the rotating of the tube and the movement of the table. Why we need to introduce the contrast agent here? Because we need to improve the visualization of our image display. All right, recent estimate place the number of computed tomography cases is getting higher, right? So in order for us to deliver this service to our patient, so we need to always look forward into the advancement in our service. All right. So given the cost and radiation exposure, it is very critical that CT is appropriate and performed with an optimal technique. All right. So one of the optimal technique that we can offer is by having this approach. Okay, so the decision to order contrast enhanced CT is actually based on the clinical question being asked. Okay, so the discussion among the specialists, the doctor that refer the case to our department, for example, and also our radiologists, the medical doctor that specialize in radiology. Okay, so they will justify the need of contrast to be inserted into our patient's body. Okay, the contrast media are used in order to differentiate between the organ and also to improve lesion detection and also the lesion characteristic. Okay, when we want to come up, when the radiologist wants to come up with a definite diagnosis. Okay, the type of contrast agent and route of administration can increase the diagnostic yield of the study audit. Okay, in this figure, I'm showing you this figure to show, okay, this is general idea about the low contrast image and the high contrast image. So it will goes similar to our CECT as well, okay, as you can see from this image, okay, where the father and his son zebra crossing here, but we cannot visualize the details, okay, compared to high contrast image. So this is where the idea comes in, okay, where we can provide the image, the computed tomography image in very high contrast, meaning we can also underlying the structure and anatomy structure, the normal structure of the anatomical structures within the human body, within our patient's body, as well as the pathological processes within the patient's body when it comes to higher of contrast image display. Okay. All right. So what are the contrast material that we are going to use during our CECT. All right, the most common contrast agent used in CT imaging, barium-based, and also iodinated base. Okay, this is two most common material used in order to enhance the appearance in structures within the human body system. The specific agent and routes of administration are based on clinical indication the patient is specific contrast agent. So back to our radiologist and also the physician who refer the case to us in our computer tomography unit, for example, between now, okay, physician, radiologist, to obtaining for obtaining the most study at the lowest cost and most importantly at the lowest risk towards our patient, right? So basically three most common routes of administration of contrast media in CK. Firstly, we can give the contrast media or we can administer the contrast media orally, meaning the patient has to drink the substance in order to opacify the structure. All right. Secondly, we can administer through intravenous, okay, meaning we inject the contrast media, okay, the water soluble contrast media to the vein, into the vein, and the flow of contrast media set the perfect timing in order for us to get the enhanced visualization of structures. And number three, this is the third most common route of contrast media administration is through rectal. Okay, we need to insert the contrast media into the patient through the patient anus until it fill the patient's rectum. Okay, this is basically towards to visualize the area of pelvic region. All right, intravenous contrast media. Intravenous contrast media, this contrast is injected directly into the bloodstream, as I mentioned just now, through a very small needle or IV line. Okay, so it will enhance or highlight the blood vessel, okay, in arterial vasculature and also venous vasculature. And it will go to urinary system, our kidney, ureter, and urinary bladder before it will flush out through the urine. Okay. Oral contrast. Oral contrast, this type of contrast media indicated, okay, where we introduce the introduction of contrast media by having our patient to drink the contrast media. Okay, it can be maybe barium or gastrography mixture, okay, into a sweetened or flavored drink. Okay, so this is to ease the process for patient to digest the contrast media. Right, it will minimize the taste of barium typically. Right, so by having this kind of approach, we can highlight basically the digestive system within the human the patient's body. Okay. Lastly, the rectal contrast. This contrast is delivered via enema, meaning through anus into the rectum, and it will opacify the area. Okay, we can highlight the area of the patient's pelvic. All right. So here we have another figure showing you the comparison between non-contrast image. This is at the area of the patient's abdomen, okay, in cross section. This is, we call it as axial section, okay. Comparison between non-contrast image with contrast enhanced image on the B image here, okay. Okay, so here we have actually two types of contrast media administration. Firstly, through intravenous contrast media. Why? Because we can see the appearance of high contrast image over here. If you can see here at the artery, okay, in the blood vessel. And also we can see appearance of contrast media in our kidney. Okay, this is the cross section of the kidney. Okay, left side and on the right side of the kidney. All right, meaning contrast media already passed through the kidney in this image. Another appearance, as you can see, another comparison you can see here from to compare between non-contrast image with the enhanced contrast image is where you can see the image of contrast media in the stomach area. Okay, uh, uh, here also we can see the contrast media in the stomach because non-contrast media typically only refers on the contrast media with introduction of contrast media through intravenous. Okay. Okay. So now this is the figure 4 showing our dedicated instrumentation. Okay. This is our dedicated apparatus used for to deliver the content. Okay, perfect timing, perfect pressure, okay, to minimize the risk during the contrast media insertion. Okay, so we have this automatic power injector. We call it as automatic power injector. So as you can see here in this image, we have tubing, okay, the long tube. So as the patient goes into, okay, so right, is significance of obvious contrast media and another one for normal saline. So become a mixture through throughout the process, so it can be safely delivered into the human body system. This is for contrast media insertion intravenously. Okay. All right. Another image also here. I'm showing you the oral contrast media selection. Okay. This is from internet. I found it in the internet. Okay. This is banana smooth berry suspension available on the net. Yeah. Okay. Not only banana, as we can also have this apple, I guess, apple flavor, okay, strawberry, okay, strawberry, so you can pick the strawberry smoothie. It's actually berry and sulfur flavored mixture, okay, so it can minimize the taste of barium, so it will also help the patient to drink this contrast agent, okay, berries, and also you have here chocolate. Okay, so you can pick your flavor. Okay, so depends on the clinical facility. So it may offer this kind of mixture to help our patient ingest the contrast media. All right. The next figure showing you another comparison. Appearance of image without contrast media in A and with the contrast enhancement. All right, this is involving intramural hematoma, presently ascending aortic intramural hematoma indicated with arrows on A image contrast, pre-contrast without insertion of contrast media intravenously, and in B image, post contrast after injection of contrast. All right, so you can see the very clear outline of hematoma. If let's say our radiologist would like to measure the size of hematoma, so you can see clearly where the outline when we compare the image A compared to image B, we inject the contrast media intravenously. Okay. So for us to deliver this type of approach on CECT, we need to carefully select our patient. As I mentioned, not all the cases indicate for contrast media insertion or administration. So it must fulfill these four goals, okay, four general goals. Firstly, to ensure the administration of contrast media is appropriate for the patient, okay, and also for the indication, okay, appropriate for this particular patient and this particular indication. Not all cases suitable for contrast media insertion, right? Goal number two is to balance the likelihood of an adverse event with the benefit of the examination. So you need win, justify benefit the examination and also adverse reaction media insertion, right? To promote goal number three, to promote efficient and accurate treatment. We want to do this kind of approach or CECT protocol, for example, all right, it must promote the efficient of the diagnosis, efficient accuracy of the diagnosis, and also towards the excellent treatment management to our patient. Okay, and lastly, goal number four is to prepare to treat if there is reaction the insertion as a medical person to prepare if there are able to understand and adhere. Yeah.
Technical issue. This technical issue. We will while we're waiting for this issue to be resolved. I will play a for my
Okay, all right. Sorry again. Hopefully, this time the technical issue will be resolved. Right. So let's finish it as soon as possible, as fast as possible. All right. So let's move into the common indication. Okay, common indication for contrast material used in computed tomography of the abdominal area. Okay, we will typically recommend for the following cases, including pain, to detect cancer, or even for patient who to assess the treatment progress. For example, if patient again come to our department to do the follow-up cases, okay, after certain treatment, for example, patient already undergone a treatment, so the physician would like to see the patient's condition, patient's disease. So patient again come to our department, so we can offer this kind of examination, CECT, in order to highlight the visualization of the area, right? Okay, so precaution. Precaution before arriving for the procedure, the patient will be given a specific instruction on how the preparation of to prepare the examination, because this contrast material, this contrast agent, barium base and also iodinated base, carry a slight risk of causing an allergy reaction, or we call as adverse reaction. So you need to the patient on the patient side also, they need to tell the medical specialist, okay, the medical doctor, the nurses, about the following condition. Okay, typically typical condition that would affect or give the adverse reaction after receive the contrast media. Okay, this condition including previous allergy reaction to contrast material. For example, you have already went through contrast administration, for example. Okay, so inform the medical personnel about your previous allergy reaction, allergy to any kind of food, drug, for example, all right, medication that you are taking. Okay, you need also to inform your medical personnel about the medication you are now currently taking. All right, the recent illness, recent surgery, or any medical condition. All right, need to inform your medical personnel. History of asthma and also history of heart disease, diabetes, the kidney disease, thyroid problems, and also any kind of pathological condition which involve the blood abnormality. Okay. Okay, here comes into the image appearance. Okay, when we give a contrast media, this is one example, a very good example actually, by having the contrast media inserted through oral. Okay, this is one patient, 67-year-old man, for newly diagnosed prostate carcinoma. Okay, the CT scan performed on this particular patient, the patient cannot be admitted IV contrast. IV here meaning intravenous contrast media due to chronic renal insufficiency. Okay, so just the oral contrast media were given. Okay, oral contrast media was administered, but due to the wrong timing, okay, not wrong timing or over timing we call it, okay, so the contrast media already passed from the patient's stomach. Okay, just now I mentioned about the perfect timing of the contrast media administration and also the scanning time. Okay, so in this case, the contrast media was given, but it passed through the stomach and proximal duodenum. So the abnormality cannot be visualized in this kind of patient or cases. All right. So, but after a few months, after 1 month, okay, another CT scan was performed. Okay, this time a very good gastric distension with full capacity of oral contrast actually reveals an unsuspected polypoid gastric adenocarcinoma, which arising from this point of the patient's stomach. We call it as lesser curvature over here. Okay, only by having the contrast media clearly placed into the stomach, we can underlying this abnormality clearly. Okay, compared to the previous um, images. Okay, due to incorrect timing. Okay. All right, another example. This is through intravenous contrast media. This is also because of the protocol, the timing of scanning. Okay, we give contrast media. Okay, at different timing. Okay, we scan at different timing. This first image after 18 seconds uh, from the first injection of contrast media, we can get this kind of contrast, image display compared to if we get the image correct timing at 35 seconds, we can visualize the contrast appearance of the hypervascular lesion in this patient's liver. Okay. All right, another example. This is through rectal contrast media. A figure showing a patient with anastomosis in the lower abdomen after resection of sigmoid carcinoma compared to NECT. NECT meaning non-enhanced contrast media, non-enhanced, okay, without oral or rectal contrast on the left side of the image. Okay, left and right, left and right, left and right. Okay, compared to the right image after insertion of contrast media through the rectal, through the anus into the rectal. Okay, so obviously you can see the contrast collection at the area of interest in this image. Comparison between non-enhanced contrast CT computed tomography compared to with CECT, contrast enhanced computed tomography. All right. Okay, so we are towards the end of today's sharing session already. Okay, let me just show all of the audience regarding the reaction towards the contrast media. Okay, when we talk about reaction, adverse reaction towards the contrast media, we can classify it in mild group. Okay, mild reaction. Symptoms are limited, self-limited without evidence of progression. So mild reaction can happen, right? Secondly, moderate reaction, and lastly, the severe reaction. Even it is rarely happen, but when we talk about complication and risk, we as a medical personnel, we always aware of this condition. And remember the goal just now, the goal number 4 just now, we need to always know how to react if this kind of reaction happen in our patient. All right. Okay, as a conclusion, right, a good quality, a very good quality of CT image display depends on a very good contrast delivery, the choice of contrast media, whether to give to the patient intravenously, to give the contrast media through oral, or even through rectal contrast administration. Okay, and the second parameter that we need to adhere also is the perfect timing. As I shown the images, due to incorrect timing, it won't help in diagnosing certain pathology. So this is a very good parameter that we need to adhere to our protocol in CECT. Okay, on the basis of basic principle and analysis of the factors, clinical considerations and modification to the protocol design that are necessary in order to optimize contrast enhancement for most of the clinical application are proposed. As a patient, as our dear audience, okay, you as a patient, if you will undergo this kind of examination, for example, in future, you need to make sure that you get all the information. You need to make sure that you are having all well information, okay, well informed about the procedure itself, okay, the computed tomography itself, and also about the contrast material, contrast substance that going to be administered to yourself. Okay, you need to get all the comprehensive knowledge and information before you agree to that particular procedure. Okay, discussion, a proper discussion, okay, a transparent discussion, I must say, okay, of the procedure, preparation, and also possible effect, reaction, and careful explanation of the procedure help to reduce your anxiety, the patient side, okay, and to prepare the patient, okay, psychologically, okay, to undergo this such examination. Here I found a very comprehensive guideline or brochure prepared by UCONN Health, okay, through the net. This is they established this kind of information card, okay, towards their patient in preparing for completed tomography scanning. This is very good approach to prepare our patient, to prepare our public before they undergo this kind of examination. All right. Okay, so with that, I thank you for your very kind cooperation. Okay, patient, since we are having this a few technical issue today. Okay, thank you very much. So I pass my stage to Puan Umi. Thank you very much, everyone.
Thank you, Ms. Aino, for the insightful presentation. Dear viewer, if you have any question about this topic to Ms. Aino, please leave a comment. And also, please fill in the survey form, which can be found in the comment section by the end of this webinar. ESET will be awarded. Ms. Aino, I think the flavored contrast media is very nice to see the upgrade of the flavor. Okay, last time I think the contrast media is don't have any taste, correct? Um, yeah. Sorry for that. They got still the technical issue. We will try to get back, Miss Aino. Miss Aino, sorry for
Yeah.
the
Okay.
internet
Sorry. So sorry.
connection.
Again. Yes. Okay. So in terms of flavored contrast media, oral contrast media, okay, those days we use orange flavor. We mix with sunquick in our department. But nowadays with the advancement, so here comes the variety of flavor. It may help and ease, make our job easier, right? So even the patient also can pick their own flavor for the oral contrast media. Yeah.
Okay, thank you. We have another question from Nadia Hisham, sorry, Hisham. Okay, is there any approach for contrast administration? Sorry.
Yes, thank you, Miss Nadia. We have another approach beside this three approach of administration of contrast media. We have also possibility of administration through okay, for women, okay, to opacify the pelvic cavity. All right, so we name it as negative. Yes. Yes, but it's commonly used. Hopefully,
Okay, thank you. Miss Aino, can you repeat again the answer because the internet issues. There got internet issues.
all right. Okay. This is regard from Miss Nadia. The approach for contrast administration. Okay, beside the approach for our sharing session just now, intravenous, oral, and rectal. There's another type of approach enhance the contrast appearance during the computer tomography scanning, namely the intravaginal approach contrast. Okay, this is also help to highlight specific area of pelvic cavity.
Okay, thank you for the answer. We have another question from one Ariba Nadia bin Abdul Razak. Is there any alternative to enhance
Wow.
contrast appearance for patient allergic to contrast media?
Okay, this is a very good question. Thank you, Wamba. I if considered as absolute indicated to be due to patient's condition as well. So our machine in our this is with software called the windowing. Okay, window approach or window. Here also we learn manage how to manipulate the image display in order to increase the contrast. We call it as windowing. Okay, thank you.
Thank you, Ms. Ainul, for the answer. Okay, I think that is the question for today's session. Okay, to our wonderful audience, thank you for joining us at this webinar. We look forward for your comments and participation in further event hosted by Masa University. Please fill in the survey form which can be found in comment section by the end of this webinar. E-certificate will be awarded. I'm also would like to apologize regarding the technical issue during this webinar. And in case of any further inquiries, you can contact us through a Masa website or visit our social media. For that, thank you and Assalamualaikum.